Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist Dr. Rudra Mohan, and today we're going to be talking about the importance of maintenance visits and recall visits. Let's start. So today I'm going to be talking to you about the importance of maintenance visits. Let me explain what a maintenance visit is all about. See, generally whenever we go to a dentist, we are either in a lot of pain or so much discomfort that the painkiller is not helping. And let's be honest, that's the whole scenario, because no one goes to even a doctor unless you have some problem. But what you really need to understand is that despite the fact that we might rid you of the problem and you might be free of symptoms, it is very necessary that you should go for a recall visit and you should go for maintenance visits. What is a recall visit? Let me explain. A recall visit is once you are done with all the procedures that have rid you of all the symptoms possible, you have to go after a periodic recall as per the discretion of your dentist, depending upon the severity of your problem and the so-called involvement of whatever a part of your oral cavity is. So once the dentist tells you you have to go for a recall visit, it is very important because we as dentists need to make sure that you are taking care of the health and you are religiously following all the instructions possible. This is highly important, especially for people who are undergoing periodontal treatment. The people who are going periodontal treatment, you need to understand that we are always at war when it comes to periodontal disease or gum disease. At any point of time, if there is any sort of laxity shown by you, you are most likely to relapse into the vicious circle of periodontal disease, ultimately leading to tooth loss. So what you really need to understand is whatever instructions your dentist or periodontist is giving you, you need to religiously stick to those, and whatever time your doctor calls you, depending upon your severity, it could be 3 months, it could be 1 month, it could be 6 months, it could be a year. Let's be honest, I follow a formula which is very simple and I call it the oral health formula, which is, I would rather call the epic oral health formula for oral health. Basically 3 into 2 is equal to 6. This is very simple math. Every 3 months you need to change a toothbrush. I've already told how a toothbrush looks like and how it needs to look like after the end of 3 months. If it's not looking like that after 3 months, you're not brushing properly. If it is looking like that before 3 months, you're overzealously brushing. So you need to be very careful. Next thing, you have to brush 2 minutes twice a day, every day, and that should take care of almost everything, as long as you're properly following the technique. If you're going to the dentist every 6 months, you are much less likely to develop any sort of problems of oral or dental nature in the future. You need to really understand this. This has been scientifically proven. The patients who have been regularly following up whatever the instructions that the dentists have given and are going for maintenance recall visits every 6 months, they are getting less cavities. They are much less likely to relapse into gum disease or any other symptoms as possible. So what you really need to understand is that whatever your dentist tells you, if they ask you to come in, it's not because they want to have a consultation or anything, or they want to, rob you of your money in the name of consultation. We just want to make sure that you are doing fine and at the same time you're following whatever instructions that we have given to you. We will also get to know how you're responding to the treatment, what kind of susceptibility you might have. You might be susceptible to let's say cavities or decay, or you might be more susceptible than others to gum disease. Also a shout out to all the people who are having some sort of oral deleterious habits such as tobacco usage, smokeless tobacco, as well as cigarettes or smoking, and maybe a lot of alcohol abuse, because these things, when you consume them, they will definitely change the way your oral tissues behave, and it is going to obviously increase the propensity for you to might develop symptoms of cancer, which we might diagnose early, pre-malignant lesions. That means some conditions which kind of mimic cancer but are not that, but can turn into those. Please try to understand prevention is better than cure, and help us with your maintenance visits, regular visits with us. If you feel the need, we can counsel you about habits. We will be there for you, telling you how you can curb the habit, how you can kick the habit, you can quit the habit. There are a lot of ways. We have been trained to help you quit all your deleterious habits and maybe try to improve the quality of life. So this was an episode about maintenance visits. Please do consider what I'm trying to say. It's a small request to all the people watching this video. You need to go to the dentist regularly and follow the formula 3 into 2 is equal to 6. That's it for today. Please like, share and subscribe and spread the word. Have a nice day.